Being able to conceive a child is one of the greatest achievements of a person, for they can pass their family names and values and let them carry on. People, especially couples, are into much having one because this completes their desire of having a family. But there are circumstances where people could not bear a child because of some complications in their reproductive system or can be infertile, causing them to have a hard time in becoming pregnant. We may have heard some news about celebrities having a newborn baby even if they are told to have one or even if they are infertile. Because of our advanced technology in our generation today, it is now possible to have a child of your own, even if you have these problems or complications in your reproductive system. In the year 1978, Dr. Robert Edwards developed the human by fertilizing an egg in a petri dish. This procedure is now known as the in vitro fertilization or IVF, where it helps to treat infertility and/or genetic problems. In vitro fertilization is a type of assisted reproductive technology wherein a man's sperm and a woman's egg is extracted out of the body and joined together outside of the body in a laboratory dish, called insemination, and transferred the fertilized egg, known as the embryo, inside a woman's uterus. For a young patient, a single embryo is indeed ideal. Anyhow, the older the patient, the more likely to put in more embryos to lessen the possibilities of failing. In relation to this, if more than one embryo is introduced to the uterus and more than one work, especially for younger patients, they will most likely expect in having twins. So in vitro fertilization, you can choose whether to have a single child, twins, or even more. Deciding the sex of your child is also possible, especially if a person or a couple also wanted to have a family balancing or having an equal count of one sex and the other in a family household. Despite having the need to take it easy after the procedure, most women can continue and go on with their normal activities the following day. It is also said that the IVF cycle could cost around 250,000 pesos to 300,000 pesos, except for any additional services to the specific program, which is still a good deal in return of having a conception with regards to being infertile. However, if one cycle is unsuccessful, there is a need to cash out similar amount for the second cycle, but it happens only if there are many complications present. IVF remains as the most ideal option to treat infertility such as endometriosis, blocked fallopian tubes, male factors, and other unidentified infertility of a couple. IVF is used to maximize the chances of a woman that has advanced maternal age to conceive a child using her own eggs, even if her opportunity for conception are declining due to her low ovarian reserve. It also gives higher chance of conceiving for couples with male infertility compared to conceiving naturally. For now, IVF is still not the common thing to do because people are hesitant to let others know about their condition. Infertility is considered as a disease, and like any other disease, it should not be ashamed of. Even more, it should be treated. A person or couples should not be stressed about this. In vitro fertilization is one of the keys in solving their problems. It is now time to overcome the stigma of in vitro fertilization.